So we're coming to the end of the course, and the last couple lectures, last few social issues, and then we'll have a very short time for environment, unfortunately. So today we're going to talk about abortion, and it's kind of a unique topic in the sense that in the United States, if you have a global perspective, in most of the world, abortion is not a big controversial issue. In the United States, it's just gone sky high as kind of the central issue in the American debate on values. It has tremendous political significance. Large numbers of people vote for a candidate for, say, president based solely on whether they are pro-choice or pro-life. So one of the things you've got to figure out, or try to, is why has this become so important an issue? And I think one of the reasons is that it encapsulates diametrically opposed views of our roles in everyday life. People perceive it as an everyday kind of issue. And what are the roles that I'm talking about? Sex roles, work roles, husband and wife roles, motherhood and fatherhood roles. All of those, how you perceive yourself in those roles will very much determine how you feel about the abortion debate. So, for instance, both sides in the debate agree that the issue is about murder. A pro-lifer sees images of a 3-month-old fetus, which even though only about the size of your finger, they're having visuals of blown-up photographs, and I'm sure you've all seen those things, and already looks quite baby-like, and thinks of it of being dismembered and murdered. A pro-choicer also sees it about murder, but she, in her mind, is a young woman, maybe herself, in a back alley abortion, being butchered and possibly murdered. And almost every one of the older generation of pro-choice women has either themselves had an abortion or has had a friend who's had an abortion, and they perceived it as life-saving, or if it was a back alley unsuccessful one, as life-depriving situation. Both sides agree that the issue is about babies and motherhood. A pro-life mother thinks that babies are so precious that whenever they come, they will be loved and wanted. There is no such thing as an unloved or an unwanted baby. A pro-choice mother thinks that babies are so precious that they should only be had when the woman really wants the baby and is a situation in life where they have the resources to take care of the baby. Both sides agree that the issue is about sex. A pro-life woman thinks that sex is so special that it should be guarded by strong religious and social controls so that it always has an almost sacred character. A pro-choice woman thinks sex is so special that it should be freed of worry about pregnancy and disease so that it can be enjoyed as a unique sharing of intimacy. Both sides agree that the issue is about the status of women. Pro-life women think that women are so important that their special life role of motherhood must be protected. Pro-choice women think that women are so important that they should have every bit as much control over their life roles as men have. So, just viewed in that way, one of the interesting things about this abortion debate is that the two sides, if you really get down to what the fundamental values of the two sides are, they're not different. They apply them differently. They're thinking of different instances, of different real situations in which to apply these rather same kind of fundamental human values. All right, well, obviously this is not a philosophy course and not in the slightest set up to debate the pros and cons of abortion, and that's also a kind of sterile debate. Has anybody changed their mind about abortion since they were knee-high to a grasshopper in the class? I don't know which direction you went. One has changed your mind. Okay. 2 has changed their mind. That's a high ratio. Does anybody know anybody who's changed their minds? Except for yourself, of course. 1 or 2 more people. So 3, another one. So, there's so much about abortion out there. And yet, people's attitude toward it is set very early in life by, again, these very fundamental images of what we're talking about when we talk about abortion. And no matter how it's argued, people basically don't change their opinions. So I'm not going to debate pros and cons at all. I'm going to give you as many facts about abortion as I can, explain to you the demography and the biology and the statistics and all of that kind of stuff. So there's a number of important things that you should know about abortion. And the first of it, that induced abortion is common. It's a very frequent situation. In the world, there's one abortion for every 3.2 live births. So that's 1 to 3. Each year, about 3% of women in childbearing ages have an abortion. And if you consider a 30-year reproductive lifespan, with each woman having a 3% chance each year, that's 90%. That means that in the world, the average woman has a 0.9 chance, very close to 1. Basically, for every woman in the world, there's one abortion in her reproductive lifetime. And of course, this is an average. Some women have many more, and some women have none. There are three or four standard ways of measuring and expressing the frequency of abortion. One is simply the number of abortions in the world or in the country or whatever you want. And the latest estimate, these latest estimates come from 2003. About every 5 years, people try to tally up abortion statistics from around the world. And it's a very difficult job because wherever it's illegal, you have very great difficulty getting statistics. In many places, especially where there's religious opposition to abortion, the statistics included as menstrual regulation. That means a woman has missed her menses, and of course everyone knows that's not a good thing, so you have to restore the menses, and you do exactly what's an abortion. And everybody in the country will understand what's going on, but the statistic is menstrual regulation. So depending on what's happening in the country, you usually have to add one part of the government statistics about menstrual regulation to another part which says abortion. Anyway, there's lots of problems in collecting these numbers, but they're probably fairly decent because they very demographically very sophisticated people are the ones that try to make these best estimates. So the number of abortions in the world is now considered to be 42 million per year. And the number has stayed in that range, the 40 to 50 million range, for at least the last 2 decades, when there's fairly good collection of the statistics. So that's the number. The abortion rate is defined as the abortions per 1,000 women in reproductive ages, which is usually taken as 15 to 44 or 15 to 49. For the world, it's 29 per 1,000. So every year per 1,000 women, 29 have an abortion. That's the 3% that I mentioned earlier. If it was 30, it would be exactly 3%. Both the highest rate and the lowest rates are found in Europe. Western Europe has 12 abortions per 1,000 women per year. Eastern Europe has 4 times as many, 44 per 1,000 women per year. So it's interesting that of the whole world within Europe, which we sometimes consider a cultural entity, it isn't with respect to abortion. The highest and lowest numbers are found in Europe. Another way of expressing it is the abortion ratio, which is the abortions per 100 live births. And that's what I told you before, 1 abortion for every 3.2 live births. In the world, that comes out to 31 per 100. And this ranges from 12 in Middle Africa, it's a low rate, to 105 in Eastern Europe. Again, Eastern Europe has the highest in the world. Note that 105, we're talking about abortions per live births. When you have 105 abortions per 100 live births, there are more abortions than live births. So at 100, half of pregnancies are terminated with an abortion. Interestingly, the abortion rate is the same, is very closely the same, independent of whether you're in a developing country or a developed country. The rate in developed countries is 26 per thousand, and in developing countries is 29 per thousand. Not a huge difference. China, which everyone worries about the forced abortions there, has about 20% of the world's population and has about 20% of the world's abortions. The last number that I'll tell you about that people calculate is what's called the total abortion rate, which is calculated exactly in the same way as the total fertility rate. But you take the age-specific abortion rate and add it up, and it's the number of abortions that the average woman would have in her lifetime if she continues with the rates that are present at the time you collect the statistics. And again, I mentioned this, in the world it's 0.9, very close to 1. The average woman will have 1 abortion in her lifetime. It ranges from a low of 0.2, 1 abortion per every 5 women in several countries, to a high of 1.7 in Cuba, almost 2 abortions per woman in Cuba. Well, I'll talk later about the very interesting situation in Cuba. So over time, as I said, the number of abortions is really on the big scale of a couple of decades, staying pretty constant. But from the last compilation in 1995, the estimate was 46 million abortions, and now it's down to 42 million abortions. So there's been a very small drop in the number of abortions. And where do you think all that drop has occurred? Eastern Europe. And again, they had an extremely high abortion rate. It was the mechanism of contraception there, and they're gradually becoming accustomed to contraception. So their abortion rate is going down. 3/4 of the change in the whole world are all due to Eastern Europe. The United States looks pretty much like the rest of the world. There's 1 abortion for every 3.2 live births here, which is exactly the number that is the average for the world. In the United States, there are 1.3 million abortions in, again, 2003, the last time this statistics collected. The rate is 21.3 abortions per 1,000 women. If you look per woman, the US looks a little better than per birth. That the total abortion rate for the United States is 0.64 per woman. That means 2/3 of the average is 2/3 of women will have an abortion during their lifetime, whereas the world is closer to 1. So we have a somewhat lower rate, and again, the difference is the use of contraception, and I'll talk about that later. The United States, although somewhat better than the world average in this, is not nearly as good as the 0.2. Remember I said ours is 0.64. Belgium, Germany, and Switzerland all are down at 0.2. So less than 1/3 of the number of abortions per woman that we have. So a cohort of 1,000 women going through their reproductive life will have 639 abortions. And that's assuming we currently have been having a reducing rate of abortion. Here it presumes that rate will stay down. So expanding out to the world again, abortion can be a major method of fertility control, especially when a country first goes through its fertility transition. And one of the fastest fertility transitions in the world was in Japan, of all places, where they halved the birth rate. The birth rate in Japan was halved between 1947 and 1957. In 10 years it went down to half, from 34 per 1,000 women to 17. And it's remained at that level more or less until 1979, and now it's getting even lower. And here is, this is the interesting case of Japan. So this is the years 49. Remember MacArthur, the US administration of Japan was still sort of tailing down at that time, and we're looking at a 10-year span. This is the number of pregnancies, which is births plus abortions. And you'll notice that during this time, during this 10-year span, the number of pregnancies really does not change an awful lot. Notice 2,700, 2,700, 900, 600, 800, 800, 600. So the number of pregnancies does not change. But look what happens to abortion. It gets legalized here, and very rapidly it goes from 100 to 10 times as much. Correspondingly, the births go down. So abortion goes from an insignificant fraction of births to much, much closer to the number of births. So in this case, it was legalization of abortion that sort of, boom, caused the Japanese birth rate to fall. There was no coercion involved. It was purely a legalization step. In many places, abortion is the method of birth control. So in the Soviet Union, the official statistics before it fell apart were that there were 5 to 8 abortions lifetime per woman. In the Ukraine, it was 10 to 12 abortions per woman. The immigrants that come to America say that's nonsense, that it was 20 to 30, that everybody they know had 20 to 30 abortions lifetime. Japan also, because although they legalized abortion very early, they didn't legalize the pill until just a few years ago, and they legalized it when Viagra came out, and the men demanded to get Viagra. They have a very good national health plan. It's all free and very careful and very good. And men wanted free Viagra, and then it became politically impossible to keep women from having the pill but pay for men's Viagra. So Japan legalized it very recently, the pill, and their abortion rate has always been extremely high. In some special circumstances, the abortion rates are sky high. So in 1966 in Romania, there were 408 abortions for every 100 live births, 4 abortions for every 1 live birth. And the history of that is very, very interesting. In the whole Soviet bloc, it was a complex of issues. Contraception was legal, it was kind of available, but the manufacturing was terrible. So they had condoms in the various Soviet bloc countries, but they were so poorly made that the people called them galoshes. they just didn't fit. Plus, the doctors were working for the government and not paid very well, but they could privately, outside the government statistics, they could privately do abortions and make money on it. So the doctors were all pushing abortion, and a variety of other reasons. We'll talk more about countries in which abortion is by far the dominant means of birth control. Legal and medically performed abortion by a trained doctor is one of the safest methods of birth control known. And here is the statistics on this. This is from the physician's desk reference. For many years, all of the birth control pills had to have this graph in it. And what do you see here? This is the annual deaths for women per 100,000 non-sterile women who are either using or not using birth control. What you notice, the really high category, which is the only super duper high, is women over 40 who smoke. Bad idea. Oh, and use the pill. Smoke and use the pill. That's pill. The pill is their method of contraception, and they smoke. If you're over 40 and you smoke, don't use the pill. That's not a healthy thing to do. For every other category of woman, the white bars are larger than any of the other bars, and the white bar is not using contraception at all. And what this tells you is if they're not using contraception, they're going to get pregnant, and that the mortality dangers, this is deaths, so this is mortality, that the mortality dangers from pregnancy are a good bit higher than any of the other methods of birth control.
Sorry, what year was this back from?
What?
What year was this from?
This is, I think, about 1990. And hasn't, well, what has changed is that, let me finish and I'll tell you what's changed since then. So the safest is these little black bars, which you can hardly see, which is traditional contraception, which is condoms, what they're talking about. backed up by abortion. That is the safest of all methods. And then the other methods like diaphragm and condom, IUD, pills for non-smokers, abortion only, are all sort of low but intermediate. So the story is, with the exception of older women who smoke, the worst thing you can do is not use any method. That's dangerous. The best thing you can do is use a condom backed up by abortion. That's surprising because there's so much popular myth out there that misconstrues these facts. Now, what has changed is that this data was taken in the earlier days of birth control pills, which were high dose, and you've probably heard about this. They used to have very high dose because it was new, they didn't know about it, and they wanted to be sure the main thing was to prevent pregnancy. Then they realized they could get away with lower and lower doses, and the pills nowadays have much lower doses, so they're much less side effects. So all of these columns will probably be way down from what they were. So, and yeah, that's what's changed. When you go to the developing world, this is United States data. When you go to the developing world, of course, pregnancy itself is much more dangerous. Childbirth is much more dangerous. So what you see is these white bars go an awful lot higher, depending on the country. If you're in the middle of Africa, they're very high. If you're in other places, they're pretty much like the United States level.
So these are deaths associated with deaths while giving birth, or these are deaths from side effects of the
Both.
Okay.
Both. All of the above. Okay, not only, so this just shows you immediate mortality, and it's clear what's going on. Abortion apparently has no long-term clinical effects whatsoever. There's no physical effects. Again, we're talking about proper medically done abortions, sterile abortions. Properly done. There are no long-term clinical effects, neither physical nor psychiatric. That it doesn't make women sterile, doesn't increase the chance of sterility, it doesn't cause you to go crazy later. None of that stuff is statistically true. Of course, there are women who, either having an abortion or not having an abortion, go through all these bad events, but statistically they're the same. The number of women who have had an abortion and eventually go sterile will be the same as those who have not had an abortion and eventually go sterile. Now, that's medical sequelae. What the emotional content of having an abortion, that varies tremendously. It varies tremendously by country. We'll talk about some countries where it's absolutely like a non-event having an abortion, and other places and other individuals where if their own ethics, their own morality, their own desire for a child, their religion, if it really is opposed to abortion, then there can be a lot of emotional difficulty with it. But that's not a thing to do with the abortion itself. It's to do with the, shall we say, the moral context in which that woman perceives the abortion to have been done. Along with this, so you have these generally quite high rates of abortion around the world, and the question is, what are the determinants of that rate? What makes the rate higher? What makes the rate lower? Many people believe that religious prescription, that the religion of the country is what is the determining factor, but it's not. For instance, in Europe, among Catholic countries, Belgium has one of the lowest rates in the world, 6.8 per thousand, and Hungary, another Catholic country, has one of the highest, 34.7 per thousand. So you span the whole range. Among Muslim countries, Bangladesh has one of the lowest rates, 3.8, while Turkey has 6 or 7 times that rate. And again, the Bangladesh rate is a little confused because they use a lot of menstrual regulation there. The US, largely, but certainly not exclusively Protestant country, has about the same rate as Turkey. So, Turkey is essentially all Muslim, of course. People believe that the Catholic Church, of course, teaches that abortion is a mortal sin, it's murder, but in the US, the abortion rate for Protestants which is 17 per thousand, is lower than for Catholics, 24 per thousand. And as far as one can tell, Catholics, because of church prescription, slightly underuse birth control, so as a compensation, they slightly overuse abortion. The error bars in all these basically mean that there's a barely detectable difference between, say, Protestants and Catholics within America, within any one country. So there's two issues of why the Catholic rate is higher. Yeah.
Are these per life birth or per thousand women?
This is per thousand. Those are numbers per thousand. Per thousand women of reproductive age, not per thousand babies. So the Catholic thing is the most of the difference in that statistic is that there's a large Hispanic population in America, which happens to be Catholic and has a higher abortion rate than native-born women. So that is the most of the reason why the Catholic rate is higher. It's also, you can't tie it down to legal proscription, whether abortion is legal or not legal. You can't tie that down as a determining factor in abortion either. About half of the abortions in the world are illegal, and the old statistics use the word illegal, but now there is such a variety of legal rules and such a variety of situations in each country where it's legal or not. And now different states in different countries, like in Mexico, Mexico City has one law. Each state can have a very different law. So it gets to be very difficult to describe legality, and that's all tied in with safety, which we'll come back to. And you see sometimes statistics about safe abortion, sometimes statistics about legal abortion, and usually they fit right on top of each other. So about half of abortions in the world are illegal, the other half are legal. So for instance, in Europe, abortion is generally legal everywhere under a very wide range of conditions. Its abortion rate is 28 per thousand. In Africa, where it's illegal almost everywhere, it's 29. So again, no difference. The lowest rates in the world are in Western and Northern Europe, where abortion is accessible with few restrictions. So basically the total legality of abortion is in a place where the rates are very low. Up to 2007, abortion was banned in Mexico, so it was totally illegal everywhere in Mexico. Nevertheless, the number of abortions rose by 50% between 1990 and 2006, with a constant legal situation of illegality. And in 2006, Mexico's abortion rate was 40% higher than the US rate next door. And so here you have three countries that are all in a line: Canada, the US, and Mexico. Canada has much lower, the United States is in the middle, and Mexico, and those two are legal. In Mexico, it's illegal, and it has the highest rate of all. So, but of course, I should warn you, and you probably realize it, that saying that abortion doesn't, that the legal thing is not the determining factor, these intercontinent comparisons, intercountry comparisons are not terribly informative, because so many, between say Mexico and the United States, or between Africa and Europe, there's so many variables, so many socioeconomic variables. Education, medical care, standard of living, all of this varies tremendously. And the difference in abortion rates is not to be found in the legal or illegal nature of it, but in some of those other characteristics. Okay, in most countries, abortion is legal, and as of a few years ago, 61% of the world's people lived in countries where abortion is permitted basically without restriction or in a wide range of reasons. Only 25% live in places where abortion is largely illegal. These are largely Latin America, some of the Muslim countries, and sub-Saharan African countries. Abortion is becoming legal in more places. From 1985 to 98, 19 nations significantly liberalized their abortion laws, and only Poland delegalized abortion, which had to do with its independence basically from the Soviet Union at the time. That was 85 to 98. From 98 to 2007, again the latest data, 16 nations liberalized their abortion laws, And 2 territories and 1 state in Australia liberalized its abortion laws. And in Mexico, I mentioned. Mexico City has now made abortion in the first 12 weeks legal, and that was in 2007, I believe. And then a few states in Mexico has followed that. So Mexico's now split place. In this 98 to 2007 time frame, El Salvador and Nicaragua, which already had very restrictive abortion laws, went to absolute, under no circumstances. Abortions totally, no rape, no death, health of the mother, no exceptions in Nicaragua and El Salvador. In contrast to the safety of legal abortion, where abortions are, when it's legal, it's almost always done in a proper medical situation. When it's illegal, it's an extremely dangerous procedure. There's something like 67,000 abortion-related deaths a year, and that leaves 220,000, 250,000 children without their mothers. As you may know, when it's illegal, the main procedure is inserting something up the uterus and scraping around to try to dislodge the endometrium and the fetus. Well, if you're scraping around in there with a pointed stick or a hanger or something, you're liable to puncture the uterine wall and make a hole between the inside of the uterus, which is open through the vaginal canal to the outside, and the peritoneal cavity, the inside of your body, and so infection gets through that. And so the main route isn't, the main reason why illegal abortion is so dangerous is that non-sterility of whatever it is that's inserted, plus it's pointed usually, and they break right through the uterine wall. In addition, you may know that the fallopian tube is open into the peritoneal cavity because the ovary, which releases the egg, it sits right on top of the fallopian tube, and the egg is released into the peritoneal space, just to the body fluid here, and it's supposed to drop down into the fallopian tube and cilia push it down. But that's an opening, so if you get something unsterile into the womb, and then the bacteria can swim upstream and you're into the body, and then you're into sepsis, and you very likely die. It's a very dangerous procedure when done not properly. The very good statistics showing that the main determinant of the maternal death rate from abortion is its legal status. So I think I have this. So here again, I don't think I showed this slide. So here is places where abortion is legal. Here's the abortion rate. This goes back to saying that the legal situation doesn't determine the rate of abortion. Here are various abortion legal places, and the rate is about 6 to 26. And here it's illegal, and you have the range of 23 to 52. So, ballpark double or triple this rate. So it's illegal. These are all South America. This is all Europe, Japan, Australia, United States. Very developed countries, countries that are partially developed, shall we say. So the illegality correlates with the abortion rate, but is almost certainly not the cause. Certainly being illegal is not causing these high abortion rates. But now when you go over and look at the maternal deaths, you see that there are 10, the developed regions have an average of 10, whereas in Latin America, you have up in the 100 and 200, and even up to 300 range. You go to Africa, 650. So there, the illegality really does make a difference in the maternal death rate. That's the dominant effect of making something illegal doesn't change the abortion rate. We have a number of examples, but it changes the maternal death rate very, very clearly. The most extreme example of this, and the clearest example of this, is from Romania. Romania had, after World War II, when it was a Soviet puppet state, As I told you, the abortion rate was extraordinarily high, like 4 abortions for every 1 live birth. And because they had a dictator then, Nicolae Ceausescu, who you undoubtedly have heard of, and he decided that for the glory of Greater Romania, there should be more Romanians. He wanted a big, strong state, so he went on a pro-natalist campaign. Abortion was immediately criminalized. Contraceptives became very hard to get. They wouldn't import them. They didn't manufacture them. So what he did is that all women between 18 and 45 were rounded up at their workplace. Remember, this was a socialist state, so almost all the women worked. They're rounded up at their workplace and subjected to a gynecological examination. And if they were not pregnant, they had to explain to the government why they were not pregnant. So it was about as intrusive a pro-natalist campaign as you can imagine. It's somewhat the mirror image of China's anti-birth campaign. Romania had the Bless campaign. Anyway, what happened immediately, so previously 80% of pregnancies had been terminated with abortion. Abortion disappears, and it was legal, abortion had been legal, and boom, the birth rate does indeed go up, nothing like by a factor of 5, but something like a factor of 2 as I remember, but I want you to check that. But then very rapidly, women set up networks of illegal abortion providers, and the birth rate goes up, and the birth rate comes back down, and it ends up somewhat higher than it had been beforehand, but not enormously higher. But the maternal death rate is what changed. It rose to 200 per 100,000 live births from a number in a developed country, something in the 10s or 20s. It ranged to 10 times that amount. The infant mortality rate, because these mothers didn't want these children, presumably, the infant mortality rate rose to 83 deaths per 1,000 from Japan's rate is 4.8, the US is 8.9, so it rose to 83. So again, something like a 10 times increase in infant mortality. So the main effect of delegalizing abortion was a temporary rise in the number of births, but a long-term increase in maternal mortality and infant mortality, massive increase. By the time abortion, of course, when they got free of the dictator, it was legalized again, and then by that time, things had come back a little normal, but still the maternal death rate, as soon as they legalized abortion, the maternal death rate dropped by a factor of 3. So that's Romania's one example. In South Africa, more recently, this was in the late 60s, the Romania story. In South Africa, the abortion law was liberalized, and the incidence of maternal infection due to abortion dropped in half. So in all cases, the major effect of making abortion illegal is an increase in complications of abortion. You don't change the abortion rate, but medical complications, death of the mother, death of the infants. The fundamental, so we've been going through things that are not the cause of the high abortion rates. It's not the religion, it's not the legality. The fundamental cause is kind of obvious, is unintended pregnancy. And you may remember that there are very high rates of unintended pregnancy. Oh, here is a comparison of 2 regions. Almost all legal in the developed countries, and in almost all of Africa, it's illegal. And the death rate's an enormous difference there. So you may remember these statistics, just to refresh your memory, about unwanted fertility. So this is 71% of Bolivian women want to stop having children, yet, as I showed you before, they have more, they continue to have children because they're not using contraception. They don't have enough contraception. And here around, that's Bolivia, and this is from previous lecture around the world. Remember, this is the line where this is how many children people are having, this is how many they want. This is the line where they're equal. All countries, all developing countries are having more children than they want. So there's a large amount of unmet need in the world, and the estimate for the world is 108 million women. And these, since there's an unmet need, these women who don't want to have more children yet do, that results in some 51 million unintended pregnancies. And of those using contraceptive, another 25 million happen as a result of incorrect or inconsistent use of contraception or method failure. So you have something like 80 million unwanted pregnancies. In the world, there's 210 million pregnancies annually, and about 40% of them are unplanned. And about a quarter of we know from a lot of places that when there's an unplanned pregnancy, about a quarter of them end in abortion. So the main sequence is unwanted pregnancy and then high abortion rate. And most unintended pregnancies in the world, most unintended pregnancies in the developed countries, so there's a difference here between developed and undeveloped countries. Contraception is very available and highly used in the developed world. So in the developed world, most unintended pregnancies are of people who are using contraception and using it fairly accurately, but there's a method failure, that the contraception just fails. And you have to remember that a woman is fertile for, say, 30 years of her life, and she has 12 monthly cycles in a year, a little bit more actually, because the cycle is 28 days in principle, but that's close enough. And so in order to not have an unintended pregnancy, her contraception must be perfect for 30 years, 12 cycles a year. That's an awful lot to expect of a contraceptive, and just contraceptives, are just not that good. So in developed countries also, the main reason for unintended pregnancy, it's married women who are using contraception. They usually have several children already, and the contraception fails. That's the main reason in developed countries. In developing countries where contraception use is less prevalent, the main reason is non-use of contraception. There's a very strong relationship between contraception and abortion. So we have most countries in the world with this unmet need. Women, before you start collecting statistics, want fewer children than they're having. But it's not a big deal. Then something changes, could be we've discussed the reasons of a cultural change, an economic change, whatever, and people really start wanting to have fewer children. So this happened around 1964 in Korea, and I gave you one of the stories about an example of how this happens in Korea. And what happens is as the whole culture changes from wanting the sort of a maximum rate of fertility to wanting a lower rate of fertility, the abortion rate picks up first, because in all these countries abortion is a traditional method. The women know it and are moderately comfortable with it. So you see first the abortion rate starts going up. Then with a short lag, the contraception rate goes up, because all the countries establish national family planning programs. And what happens as people use more abortion, use more contraception, so they're reducing their fertility, but the rate of drop of desired fertility can be so fast that even the sum of contraception and abortion can't keep up with it, so both rates keep rising. Eventually, you peak where abortion peaks and starts falling down. Contraception continues onward. So this is the time when the demand to have less fertility is more than either method alone can cope with. But eventually women, and abortion is easier because it's a after the fact method, but eventually women learn to use contraception, learn to use it and learn to use it properly, and so then the abortion rate declines as the contraception rate continues on up to very high levels. And most of the difference here is women who want to get pregnant or something. So you have this trade-off. You have in an early stage, both of them rise together, and in a later stage, they do very divergent things. And you'll see when you get a polemicized discussion of this, what you hear is that right to life people say, oh, contraception is no good, abortion rises with contraception, and they use statistics from this half on down. People who are pro-choice say, no, 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 or pro-contraception, no, 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 it goes this way, and they use this half of the graph. But you get both of these things. And Korea is one example. Here is another example of the relationship between contraception and abortion in Bangladesh. So here is, remember Matlab, where you read about Matlab, where they chose some villages and got a very strong family planning program, and then other villages where they left alone as a control region. They had family planning because they had the government program, but the government program wasn't any near as good as the intervention program. So here's the control region, and there's a lot to see here. So first of all, this is desired fertility, and that starts at this level and drops down to somewhat more than half. Desired fertility in the Matlab region starts at about the same level and falls about the same amount. So the difference between the two regions is not desired fertility. The actual fertility rate drops here, starts higher and drops a little faster here, so that it ends up not very different. So again, the difference is not the actual amount of fertility, which the number of births isn't enormously different between the two regions, but in the Matlab, in the experimental region, the region where they had the good program, the contraceptive prevalence goes very high, goes rapidly very high from something like 30%, more than doubles to 70%, whereas in the other the non-control region, you have, it starts much lower. This rises very rapidly. This doesn't change at all for a number of years. Then the government improves its program. It jumps up a little bit. It jumps up a little bit. So it's the contraceptive. This is a really big difference. The contraceptive prevalence is much lower in the control region than in the experimental region. And the result is, here's the abortion ratio in the region where the contraceptive prevalence is very high. And here, the abortion ratio goes crazy where they're not using contraception efficiently. And again, here you can see in those two regions, the same country, same time, neighboring villages, neighboring districts, that there's this trade-off. They either use contraception or they use abortion. In both places, they're wanting fewer children as time goes on, but in one case they use contraception, in the other case they use abortion. I think, do I have another graph of that? Here's another example of this, rather different in Shanghai. And this is a more complicated, somewhat interesting case. This is the one-child policy comes in. They're only allowed one child. So they have that child, and then they try to do something to avoid the second child. And what they use is contraceptive methods, and they don't work. They start with very let me get this straight here. They start with a low use of IUD, which is a really secure method of contraception, and the abortion rate is very high, and they rather rapidly learn that IUD is the only really secure way of not getting pregnant, and then the abortion rate falls down. So it's another rather different situation in which, again, the abortion rate and the effective contraceptive rate are mirror images of each other. When you have a high rate of effective contraception, you have a low rate of abortion. So Latin America shows this same pattern. In Latin America, abortion has been practiced for centuries. It was certainly practiced by the Incas and the Aztecs. In 1551, the Bishop of Venezuela reported to the King of Spain that the natives did not want their children to become slaves, so they aborted them. 1551. Chile has very good medical statistics. At the beginning of Chile's fertility transition in the 1960s, 23% of Chilean women voluntarily admitted to having an induced abortion. Again, remember, Chile is a very heavily Catholic country. And this is not really delving into medical records or making any corrections, just asking women, have you had an abortion? And a quarter of them say, yes, I've had an abortion. And not only did they have an abortion, but most of them had more than one abortion, up to 3. 8.4% of the women had more than 7 abortions. This is early on. 10 years later, in the 70s, now it's where women are really into their fertility decline. They don't want the children. The average woman has almost 3 abortions lifetime. So that goes up. And again, those are the openly admitted numbers, and the real numbers must have been much higher. And again, as in elsewhere, in Chile, almost all the women were married, they're almost all middle-class women, and they already had 4 to 6 pregnancies. They already had children and experience with pregnancy. In terms of socioeconomic levels, middle-class women had more abortions than working-class women. Married women had a greater abortion rate than those living in temporary unions, just casual unions. And through all this time, abortion was completely illegal in Chile, and it still is. Going next door to Peru, in Lima in the 1970s, again the time when the fertility rate was going down, when people were wanting fewer children in Peru, the yearly increase in the abortion rate was 24%. Every year there was a 24% increase in abortion. And in any given year, a quarter to a third of the reproductive age women would have abortions. It's 1 out of 4, 1 out of 3 women every year would have an abortion. Again, it's in this, the really high abortion rates are when women or families are starting to want fewer children and haven't yet really figured out how to use contraception. In contemporary Latin America, abortion, although it's illegal almost everywhere and it's almost universally a Catholic place, abortion is very widespread. Latin America as a whole has 1 abortion for every 2 live births. Remember, worldwide in the US it's 1 per 3.2. Latin America has 1 for every 2 live births. And eventually there's a generational change and the younger women start using contraception, and then the abortion rate starts to fall. Okay. The Philippines, another example. So in the Philippines, you have a very interesting situation of the politics. There's a strong interrelationship between the politics of the country, the Catholic Church, and the citizens' use of contraception. And when Fidel Ramos was president, one of the early very populist presidents, he supported family planning, and a quarter of the Filipino women were using a modern method. And since then, the desired fertility has gone down in the Philippines, and now more than half of Filipino women want some form of birth control. But the presidency has changed, and a woman, Gloria Arroyo Macapagal, came in, and since Ferdinand Marcos was a strong dictator, and they had strong presidencies, but then when he was kicked out for massive corruption and dictatorial means, they now have democratic elections, and the governments have been quite weak. They don't have much popular support, and so the government needs to get legitimacy from somewhere. In this case, they get legitimacy from the Catholic Church, because again, the Philippines is a very Catholic country. And so a fairly open deal was made between Macapagal and the Archbishop of the Philippines that the church will support you if you make abortion illegal and get rid of the family planning programs. And so now the government, and that was taken, and she got elected, and now the government only supports traditional family planning methods, which is withdrawal, basically. And this had an effect. So from like 93 to 98, in a 5-6 year period, the use of traditional methods went up by 50%, well, the use of modern methods didn't change much. But when the government pushes something, it often goes up. And all those women, the traditional methods just plain don't work. So, so the result was that the number of abortions in Philippines in these years increased by 19%. From 400,000, it was already high. From 400,000, it went up to basically 500,000 abortions. And they're all illegal, of course. Okay. As I said in the beginning, in America, abortion is a great source of controversy. This is not always the case. So in a lot of places, there's a lot of literature now on what they call the culture of abortion. Those countries for whom abortion has the non-controversial place as a mechanism of fertility control, just as contraception has a more or less non-controversial place as a form of fertility control in, say, Europe and America. So I got invited a few years back to talk to the women's health class about abortion, and it was one of the things we talked about. And afterwards I was talking with some students, and a professor with the next class walks in, and he turned out to be from Russia. And he asked us, what are you talking about? And the students had started asking me questions about something about abortion. And he was really puzzled. He said, abortion, why is anybody interested in that? Because in Russia, it's just an ordinary, absolute ordinary kind of thing. In places like Romania, and I'm sure this is to some degree true in probably the whole Eastern Europe, you remember I mentioned to you the old theory that the health of the body depends on the humors, that you've got 4 humors, of bile and choler and all this sort of stuff, and it's the balance that's important. And you have to reestablish, and what the menstrual period does, everyone knows the worst fluid is menstrual fluid, and so you've got to get rid of that. And if you're not periodically getting rid of menstrual fluid, the bad spirits, humors, fluids, build up in you, and you get unhealthy. So in places like Romania, many people, older, less educated people, believe that it's good to have an abortion every so often, having nothing to do with pregnancy even. It's just good to do that to get rid of this evil humor. And that has persisted, as well as a lot of other really almost unbelievable to us medical myths, and is part of the reason for that very, very high abortion rate in Romania. In the Ukraine, when the Soviet Union fell apart, the family planning programs that they had also fell apart. And so the whole area was left without effective family planning. And the International Planned Parenthood Federation, the nearest office was in Bangkok. And so they couldn't help very much. And what they did is they said, okay, we'll take just the city of Moscow, because it's most cost effective to work in a city with a lot of people. You don't have geographic issues. And we'll try to provide some contraception in Moscow. But that left all the other Soviet bloc countries with nothing. And the Planned Parenthood Federation of Connecticut here, I was associated with them at the time, got in contact with the Ukraine. The whole Ukraine was like bereft of contraception. Got in touch with the head in the university in Kiev, the head of the OBGYN department, a very nice woman, and started to help her provide, just buy contraceptives here and ship them abroad. Actually, we buy them internationally. Very cheap. A cycle of pills is 80 cents in the world market. A condom is like $0.015. Diaphragm is $1.25. So if you buy them in the United States, they're expensive. If you buy them in India or wherever they're made, things are a lot cheaper. So we could really help Ukraine a lot. What they wanted first was, because you can't use any of these things if there's pelvic infections, so they wanted monostatin, other treatments for vaginal infections as a first line, and then they could start dealing with contraception. So anyway, this program went on, but it wasn't very successful, and the reason was the women were using abortion and quite happy with it. They didn't see anything wrong with it. They were used to it and no problems, so why should we change? And so one of the things that they did, and we helped them, was we got some of these right-to-life films, which show in the goriest way, the way, what the fetus looks like and what an abortion is like, and you really are way off the deep end. and shipped them to them so they could show to their patients, say, see, an abortion is not just this sort of nothing kind of event. The most interesting case might be Cuba, which has one of the highest abortion rates in the world, 78 per 1,000 women per year, compared to Canada, which is 15.5, for instance. Again, that's the two sides of the United States. And almost 60% of what they call known pregnancies are terminated by abortion. So they have a long history. Before 1938, they were very much tied culturally to Spain, and Spain was very conservative. That was a Franco era, a very, very right-wing fascist Catholic dictatorship. And so in the Spanish law, all forms of abortion, induced abortion, were illegal, and Cuba just used that same law. That was up till 1938. In 38, they liberalized a little bit for rape, likelihood of death of the mother, or severe fetal malformation issues. But despite these restrictions, it was the mechanism of birth control in Cuba, and it was used widely by all the social classes. Well, I'll tell you an exception to that, by poor people, and it was used in the cities and in the countryside. So abortion was it. Contraception starts coming in, but it's a foreign product, and it's expensive, and you need some medical knowledge to use it. So only the upper class uses contraception, at this time, used contraception in Cuba. And at that time, very, very, a few people owned all the sugar plantations, and everyone else was basically a slave on the sugar plantations. So the social gulf between the rich people using contraception and the poor people using abortion was enormous, and they didn't talk to each other. So there was no social diffusion of the ideas of contraception. So the people just continued using contraception. 1959, Fidel Castro has his revolution, and he takes over. And in the beginning, he's anti-abortion. He still is. And a lot of events happened, and I'm simplifying a complicated history. But in 1962, the United States places an embargo on Cuba, including medical supplies. And guess what the Cubans can't get? Contraception, because the United States was their source of supply. So abortion gets more entrenched. The embargo might have done the biggest thing to raise Cuban abortion rates. No one has good statistics on that. So while abortion is legal in Cuba, the government really wants to reduce it. Castro, in 1998, the Pope visited Cuba, as you probably may remember from all the headlines, and he talked against abortion. Then shortly after that, Castro gave a 7-hour lecture, worse than me, a 7-hour lecture condemning abortion as a method of birth control. And he said it was his duty as a public figure and a revolutionary leader to oppose widespread abortion. But didn't have any effect on the people. And it's very interesting. There's now a wonderful article, which I actually should have assigned to you, about what's going on in Cuba, but you had too much reading already. And so the government and the medical establishment want to wean people off abortion. And so in these interviews, one of the things they ask the respondents, who are women of all ages and men of all ages, well, what have you heard from doctors and healthcare professionals? Well, that it's dangerous, that you can die from it. But just imagine, that's what she's heard from the professors. But just imagine if you had to give birth every time you got pregnant. I got pregnant and had an abortion when I was 15, even though I was on the pill. I also got pregnant earlier when I was using an IUD. This is a woman who at the time of the interview was age 30, and this was after her 4th abortion. And so the people's perception is very different than what they're hearing from the medical establishment and the government establishment. It's an absolutely unremarkable subject for discussion. One male who's now age 49 said, I was about 10 years, they ask, do you hear about abortion? Is it discussed? And he says, sure, I was about 10 years old. I heard about abortion from people on the street. Also in my house, my mom talked about it with her friends in front of me. Another responded, around the streets, abortion is a common thing people talk about. It's an everyday thing. A male, age 23. Do you know do you know anyone in your family, among your friends, who's had an abortion? Yes, an aunt of mine. What did she tell you? That you don't feel anything, that they give you the anesthetic and stuff, everything goes fine. That was a woman of 18 who's just had her first abortion. Another respondent, yes, friends of mine, they told me that they had it done and that you don't feel anything. That was a 15-year-old girl with her first abortion. Another respondent, my cousin had an abortion. She told me that nothing out of the ordinary happened, that everything went well. This is a female age 21 on her second abortion. Another respondent, when I was in school, a friend of mine had an abortion. She was fairly young, around 13 years old, because we were in the 8th grade. What did she tell you? How did it go? She told me it went well and said the anesthetic was fine. Girls talk about that kind of stuff. This was a 31-year-old woman on her 4th abortion. Another respondent, to the question, have you heard much talk about abortion? Oh yes, among girls at school. They don't use anything, meaning they don't use any contraceptives. So when they get pregnant, they go to get an abortion. They talk about it like it's nothing. It's like drinking a glass of water. Some people have problems when they get an abortion, but most people don't. Almost always the procedure goes fine. That's a 17-year-old girl after her first abortion. It's a very interesting case because while they're experienced, they're hearing one thing from the government, the same thing from the medical community, but they know lots and lots of people have had abortion as a common subject, and they're not hearing about any difficulties from it, or very rarely are they. So the government's pushing contraception, and they use contraception. What's really that 92% of the Cuban women have used contraception at some time or another. And even among adolescent girls, who are obviously having a very rich sex life because they're getting pregnant all the time, 84% have used some form of contraception. But it doesn't mean anything to them because they're just as happy with abortion, so they're not worried about getting pregnant, so they sometimes use contraception, they sometimes don't. And the reports of when they use it are almost totally haphazard. They'll use it for a while, they'll stop using it, they'll start again, they change methods, and it doesn't even have anything. So, of course, women go through periods, and men too, when they're in a relationship having sex or just having a lot of casual sex, and the woman will tell you this, and the use of contraception did not correlate at all with periods when the women were having sex. So just a total disconnect, and undoubtedly the reason is that they're perfectly happy with abortion and it's a fine backup, so they don't have to be terribly careful about using contraception. And in fact, as much as they're hearing that abortion is no big deal, they're hearing that the other forms of contraception are really not very pleasant. So here's more answers to survey questions. I don't like the pill because it's extra hormones in the woman's body. A male, age 19, says that. The woman, and this is a woman. No, I don't use any IUD because my body can't support it. It falls out of place. So you have used an IUD in the past. Yes, I had an IUD 2 different times, and both times it fell out of place. I have problems with IUDs. That's a 37-year-old woman on her second abortion. IUD causes pain to women. After my first pregnancy, I had an IUD inserted, but I had to have it removed because it was causing pain. I started having problems with my period and a lot of inflammation. And when I had sex, it was painful, so I had the IUD removed. Female, age 35, her first abortion. I had an IUD before. I had it for 2 years, but I had it removed because I had abnormal menstrual bleeding. A 42-year-old woman, 4th abortion. Another woman, sometimes we use protection, but the condom broke. You explain these things to the doctors, and they say that this doesn't happen. But I'm telling you, it's not a lie. Sometimes condoms are bad and they break. It's a 19-year-old girl on her 3rd abortion. 88%, so at the time of the survey, 88% were practicing contraception at the time of the survey. And again, among adolescents, 68% were using contraception at the time of the survey. Yet, the contraception, they didn't like it, it wasn't effective, and they were apparently just as happy with abortion. So it's a very interesting thing, and this is repeated in basically all of the East European countries where, again, they have a long experience with abortion, and they don't particularly see any benefit to contraception. Now, the standard thing that you'll hear in America from everybody, again, independent of their, they can be right to life or pro-choice, kind of thing, is that the idea is, and I've been sort of saying that here, the idea is to replace abortion with contraception. That contraception is a better method of birth control than abortion. It's controversial, but now it's controversial. Actually, what started me really looking into this was a number of years ago I was giving a lecture, and I was saying very overtly that, well, it's progress when contraception replaces abortion. And now it's not so obvious, because I showed you this one, that the safest method is condoms backed by abortion. And it was very hard, and so one student asked me this question about why do you think that contraception is better than abortion? And it's a very, very hard question to answer, and I won't even try to do this today. It's a very difficult kind of issue. So the final thing that I should tell you is that 'cause one of the things we worry about is population growth rate, that abortion makes a huge difference in the global rate of population growth. As I've told you, there's ballpark 75 million increase in the world now. If the abortion rate is about somewhere between 40 and 50 million, that means the rate of world population increase goes up by 75% or something, because abortion is such a large fraction of the birth rate that if abortion disappears and is not replaced by contraception, the population growth rate goes crazy. And so in the world as it is now, there's probably not any chance of stabilizing world population without abortion. So, okay, just on time. We will continue with the biology of abortion and some of the history and philosophical considerations in the next lecture.